Okay, so current treatment of endometriosis, there are methods of treatment of endometriosis. What we used to do as a gynecologist, if we suspecting endometriosis, we start with painkiller, non-steroidal ibuprofen medications, or any non-steroidal medication if it's mild endometriosis. And this painkiller can just increase and exaggerate. Start to be opiates, morphia, or sometimes now the research on cannabinoids medication because of the oils. There are some theories that it can suppress the endometriosis. But the only problem with this is the side effect, increasing the bloating, increasing the bowel symptoms, and it could be very devastating. When you stop it, you have the symptoms again. So it's not just real treating will recur you. The second line of treatment is medical treatment and medical hormone. Basically, you can take hormone pills, oral contraceptive pills, for a longer time. And this is something behind the delayed diagnosis of endometriosis because many women in their reproductive age, they are taking hormone pills even before they starting their family. And these hormone pills will mask the symptoms of endometriosis, okay, and prevent the pregnancy. Once you stop these hormone pills, we'll start to see the flare up of the symptoms. And unfortunately, very recent study published on November 21 from the States on 100,000 lady, they found that all hormone pills can affect the ovarian reserve. I mean, your storage of eggs inside the follicles by time and by how long time you will take this medication, it's differ between 5% up to 55% below the average population if they are not taking hormone pills. So if we are thinking about that on the longer term, hormonal pills will not treat it, just calm down the storm, and it will not treat. And sometimes if the pain or the symptoms are very severe, we can give some medication called GnRH analogs. It's a gonadotropin releasing hormone. Simply, this hormone will work on the pituitary gland. It's the maestro gland, and this gland will just stop secreting the hormones from your ovary by time you are taking this medication. But its effect is very devastating because you may feel menopausal symptoms that you should feel it at 50 while you are still very young. So it's something very weird and very you will pay for that over the long term. More than 6 months, you will start to feel bone ache, hot flashes, and every devastating symptoms. You will not want to feel it while you are very young. So this is a kind of hormone treatment we can give. Other line of treatment is surgery, and it's the pros and cons of surgery because surgery itself is a very complicated stuff for endometriosis. It's not that easy surgery. We can go into your tummy and find that everything is just adherent, and we will treat it. We'll remove these adhesions and will to remove the nodules, especially if deep mid endometriosis surgery for if the nodule is just if we can imagine this is the lumen of the rectum, sometimes endometriosis could be here. We can do shaving for it, or sometimes it could be implanted here, and we need to just remove all this section, remove it all, and do resection anastomosis for this part and the upper part. We remove this part out. Okay, so this is can be very fast, very required in case of deep endometriosis surgery. But what I will suggest, this surgery has its drawback because it definitely it can affect the fertility. So if you are looking for a fertility, it's another story. If you just want to have this treatment, it's another story. If it just you need to do the surgery, so do it. But if the surgery will prevent this disease from coming back, nobody knows because we have done this surgery one time and then after 1 year, same symptom, another time and three times. So I remember at 2012, we just keep repeating doing this operation and do nobody explain why it's coming back. So because it's not treating. Okay, so if we are thinking about treatment of endometriosis, we should control what we can control, which is diet and the healthy lifestyle, and it can lead actually to real effect on the long time. Okay, so this is about the treatment of endometriosis. Endometriosis and infertility, I'm gonna discuss it later on. One more point about treating endometriosis, and you should treat the other symptoms, which is the symptoms in the background noise, which is chronic pelvic pain. It may be very beneficial to deal with pain therapist. It may be very beneficial to speak with cognitive behavioral therapy in your place. Okay, and they have many things to help with you. Acupuncture can help with this pain on the long term. How you speak to yourself about this pain is very helpful. Even before doing surgery, I will advise to start to try that, to start to try this cognitive behavioral therapy, and after that, the surgery will be much more easier because it just will just treat any remaining from this dysfunctional problem in your body. Sometimes you may benefit to do other surgeries like cystoscopy to examine the bladder if there is any endometriotic nodule there or no. So this will be also helpful to diagnose and to start to look for this area about pelvic floor muscle exercise if you have any symptoms related to bladder pain syndrome. So take it as a whole. You should ask your specialist and they will inform you about exactly what to do before even start to have the surgery. Otherwise, you will feel a victim of repeated surgeries every now and then.